So there was this child who was 8 years old. When he came to us, he would not, bring his head up. He would be just so low arousal, not interested in what is happening around him. He was not verbal at all at 8 years. And it always doesn't have to be like sitting down with your child, let's talk about, how to establish relationship. Nothing like that. Netflix is a good starting point. Why should Netflix have ratings when it is not applied at home? So talk to your child about the ratings first. What does the rating mean? What does a 13 plus or an adult category mean? What does a sanitary pad mean? And not just for girls, for a boy also. Right? Start from those simple conversations. It needs to be addressed without any awkwardness. So if my daughter needs any advice, it is not necessary that she should come to me as the mother. Even dad knows how to talk to her about it. And that's how easy it should be. It is always all perceived awkwardness. The parent has already thought about कि ये पूछेगा तो मैं क्या जवाब दूंगा, ये तो मुझे नहीं समझ में आएगा.
All the justifications and all logics from
Exactly. Take it from what the child asks.
Yeah. The second part completely focuses on autism. 1 out of 40 children are autistic children, and if they are not treated in their early age, it can be disastrous not only for the children but for the entire family, which is not curable. And if at all it is taken care in the early age, how this can be miraculous for the family as well as for the child.
So consider in the early 6 months, 0 to whatever 1 year mein, the parent noticed that the child is autistic because of certain symptoms by itself, and they get to know that Sadbhav is the place where they are supposed to go.
Right.
Is it like a curable thing over the period of time, or how how much time it takes in the first place?
So this is one of the commonest questions that I get asked by a parent, that how long will it take before my child is okay, or whether this can be cured. So the first disclaimer is that since autism spectrum disorder is a disorder, it is not a disease.
Okay.
And there is still no exact identifiable causative factor for this condition. We really don't have a treatment, as in a curative treatment, to offer. So it is not like I treat the fever for 5 days, or you have malaria and I give you anti-malarials and you're okay. So autism spectrum is a lifelong condition. It is a disorder which is here to stay. So if the child comes in for intervention early, the outcomes will be the best. So what are the outcomes for a child who is on the spectrum? That if the child is showing social communication delay, the child should be able to communicate his needs, his emotions, understand a conversation, or be a part of a conversation, which are important skills as the child grows up, has friends. Nobody should make a fool of him eventually, or he should not look or feel awkward in society. That is the social communication goal for a child. Along with that, whatever are the behavior patterns, they should not get labeled by anybody else in the society also, and the child should be able to integrate in the system that we as a society have. The other important aspect of it is self-help skills. So quite often a child who is on the autism spectrum is not able to take care of his basic skills like brushing, bathing, toileting, dressing, eating by himself in the early years. So a child who is 3 years and latest by 5 years, most of these skills the child is able to do independently if given a chance. But a child who is on the autism spectrum will find it even more difficult to learn all those skills because of the sensory issues. So all these can be minimized in degree. We can actually train the child much faster and earlier, and I wouldn't say normal or abnormal, but at least the child will be integrated into the system. The third aspect is his learning. So traditionally our schools are geared for typically developing children who are able to hear okay, see all right, move all right, are able to pay attention properly, are able to communicate properly. So for a child or an autistic individual, it will be difficult to learn reading and writing, or learning in the Montessori system or in the playway system as well as any other child for that matter. So if we identify it as early as 6 to 9 months, that would be ideal. You know, I don't have enough data to say that 6 to 9 months and everything is fine, but I would at least expect that we are able to achieve near typical development if we start that early. So even at say 7 to 9 months, if a child who comes with poor social smile or not responding to name or not making eye contact, and we start intervention, I am very, very hopeful for this child that he is going to have near typical development. Right. There are no guarantees again, but if a child comes in at 9 months versus a child who comes in at 5 years, I know that the outcomes will be way better for a child who comes in at 9 months and not as much for a child at 5 years. There will still be some residual issues.
It
Right.
will take even
It'll take
very
longer.
to
Some of the
improve.
challenges may not improve at
Ah,
all. And because as the age progresses, the brain development also gets more fixated, as well as the challenges, the level of challenges also is increasing. So a child is expected to do lesser things at 9 months, more things at 5 years. So to help the child do all those things at 5 years is more challenging than something that is simpler and lesser. Along with that, yes, there may still be some social challenges throughout the child's life. uh, the child may not always be very extroverted or be able to have make friends with everybody, but all those things can be minimized by the right kind of training, and
training
that
and
doesn't
teaching.
always mean therapy. It is just giving adaptations, accommodations, even in the classrooms. A child who is, for example, in my days when we had to wear glasses, it was considered a big problem that अरे ये तो चश्मिश हो गया है. you know Now it is like more than 50% of the children are wearing glasses by the age of 10 years, whereas stammering is still a challenge, where a child who is stammering will get teased by other children. Similarly, a child who is on the autism spectrum will also show behaviors which the child can get teased or bullied. So if we can train the other children along with this child in a classroom setting as early as 3 years of age, the whole society will become more accepting of a neurodiversity. It could be Down syndrome, it could be autism, it could be a learning disability, or a clumsy child, or a child who has cerebral palsy. It is okay if the child is different. We have to teach them the way they can learn, right? So a child who's on the autism spectrum may not in the traditional way look or be normal like all other children, but definitely can be integrated, can be a productive individual, can be functionally skilled. And if they have the gifted on the spectrum, then they actually can do a lot more like Elon Musk for that matter. So yes, uh, there's no limitation to their uh, expectation or their goals. The earlier you catch them, you can set higher goals for them. Yeah.
Okay, nice. Yeah, I mean, I was thinking about one of the child I met recently, twins, IVF again. One is very jovial, listens, love appreciation, just a little bit good you say, and she'll be smiling and all. And the
Yes.
other is completely opposite,
Yeah.
very moody. That's what the parents say. They say that some Bhagwan ka avatar hai, all those things like isme, but he doesn't talk to the stranger at all. He won't even smile,
Correct.
even though the frequency is more. Still, he won't even smile or talk or give like little importance
Right.
also. Now,
Right.
is there a kind of disorder maybe in the child, or is it because I don't know? As in, you never know, right? What is
So see, I would
won't
never
the
rush to diagnose a problem, right? Observation is very important. It cannot be Whenever I see a child for the first time, and I do take an hour to at least have a detailed observation in that first hour, I still would be hesitant to just label a child with a problem straight away.
Yeah.
So I would ensure that we first only make a list of all the observations where the parents think that this could be a problem, whether it's the behavior or it is the child's learning capacity or the child's milestones for that matter. So because they are twins and one child is extroverted or very outgoing and the other child is probably shy, it seems different, right? So before I label this to be a disorder, I would first want to observe the child and understand whether the child is just inherently a shy child, or if the child does have some hearing issues or vision issues. Because if the child was born prematurely and if that is a challenge, so I had a child who had come to me, a very outgoing bright little girl of 5 years of age, and the only challenge was that the child just would not sit down for an activity, like was labeled hyperactive and was hyperactive at that time. And as I do routinely for all children, I advise them to get an eye checkup done. And parents said, "नहीं, she sees everything fine, like उसको तो देखना बहुत अच्छा लगता है screen as well." And they got the eye checkup done, and she had very high power in both her eyes. And as soon as they corrected her vision, they gave her glasses, her hyperactivity went away. So, a child who is socially withdrawn or is having language delay, I would, before labeling any diagnosis, I would want to first work up the child completely.
Yeah.
Whether the thyroid is a problem, whether the hearing is an issue, whether vision is an issue. After all that has been done, then, if the observations also indicate social communication delay or withdrawal or excessive anxiety in social environments or certain sensory issues or play skills are impacted, then yes, we would think of it as a disorder, but it is always very individual. So, one
Very good.
child and another child could be,
No. Okay.
yeah.
Okay. And when you say that, the first 5 years are
Hmm.
the brain development,
Yes.
90%.
Yes, almost 90,
Almost,
80,
almost
80
80,
to
90, whatever.
90%.
Huh.
Yes.
What is that brain development? Like 80 to 90% in first 5, 6 years. Oh my God, it
Yeah, and
feels
then you miss the bus, right?
like
Yeah.
so crazy.
So it sounds very scary that, if post 5 years you have not picked up anything, you're gone. No, no, that's not true. But yes, majority of your development peaks by that time. So when we think of development, it is like technically divided into a few domains. So there is the movement part, which is the gross skills, like, the child starting to sit up, holding the head, walking, running, jumping, which is sometimes missed. A child who can start to run but doesn't learn to jump on time by 3 years of age is a challenge. So those are the gross motor skills. Then the fine motor skills, which are the hand skills. So eating by himself or buttoning by himself, holding a spoon, joining or opening blocks, puzzles, then holding a pencil. Unfortunately, in our system, parents expect a child at 3.5 to start writing ABCD. Before that, the child should know how to button his own shirt. So that is for parents to actually understand. So gross motor and fine motor are the movement skills. Along with that, the self-help activities. So like I mentioned, the eating, dressing, toilet training, brushing, bathing should be complete by 5 years of age. Then comes the cognitive and academic learning. So a child who can point to body parts by 15 months or 18 months of age, or can do a shape sorter, simple shape sorter by 22 to 24 months, start to answer what is your name by 3 years, or name certain shapes, colors, letters, numbers by that time. Then the social emotional learning, where a child who at 7 to 9 months will show stranger anxiety. So if anybody else apart from a family member picks a baby up, the baby will give you a
Cry
look
and
and start crying.
ah,
And opposed to that, by 1.5 to 2 years, the children become more stranger friendly, will smile at strangers or answer questions. Then again at 5 years they'll become a little withdrawn, a little, shy, which are normal milestones. A child who does not make eye contact or does not smile socially or is overly withdrawn or overly anxious, all these are social emotional milestones which we need to use to identify, especially autism. So there is a checklist for autism, which is called the MChat, which is available online, which is free, which any parent can apply to their own child. It is available in multiple languages also, and at least identify if your child may be at risk, if you're worried in certain areas. Then comes the receptive and expressive language. So language in our learning is only whether you speak in English or Hindi or Gujarati or Marathi. Language is not the dialect, that is the dialect. Language is actually being able to communicate what I want to say or what I feel
Okay.
or ask for my needs, right? And it doesn't always have to be spoken. Even body language is a very important part of expression. But a child, if he doesn't learn to look at the parent appropriately, or if he does not say bye bye or smile, all these are lack of language milestones. So receptive language is what we are saying to the child, and expressive is what the child needs to start to do. So at 3 months, if the child still goo goo gaga, and by 9 months says baba tata dada, and by 18 months the child says mom or boo or appo. So that is how the language should progress. And if that gets missed out, then
There is a
we end up
communication.
with a
Yeah,
challenge.
got it.
So first 5 years, most of these milestones will have become optimum for that age. If it is not happening, then we need to work with the child as
Wow.
early as possible.
How about the people who are currently, this autism awareness is not there so much. The people who don't have this, like, foundation like this
Right,
in different cities also, or
right,
apart from Gujarat, and they have crossed that age of 5 years or
right,
10 years or
right,
15 years,
right.
how they, like, among the crowd, how they deal with it, or what is
Oh.
the
Hmm.
way out of it,
We need to find a way out.
or
Honestly, we are
understand?
still struggling. Like the Indian community, I would say, especially, we are still struggling with early identification of autism spectrum. So the systems, as far as schooling or vocational training for these kids is considered, is still not in place. Okay, and therefore most of the adolescent or adult autistics are kind of getting lost in their own family environments, are just getting taken care of by a caretaker if they have significant behavioral or sensory issues. So, giving you two examples recently that I came across, I got a call from a parent saying that I would like to meet you, and I have a son who's on the autism spectrum. So, naturally, I asked him what is his age, and he's 28 years old. So technically, this person, I'll say person, not a child, because he's already an adult, has crossed an age of intervention as far as the basic skills are concerned, but he's still not toilet trained. He's still getting taken care of by a caretaker. Now, this is a real life challenge. The father must have, I'm sure the family would have done their possible best in whatever resources they had or in whatever guidance they got. But still, this child has so many challenges. I'm still saying child because I'm so used to saying that. But he has so many challenges. Now, as a technical person at the foundation, it I would have to really put my mind to think how we can incorporate his therapy or his sessions, or how can we help him better. Bringing him in for therapy to teach him ABCD is not the target now, or to teach him basic skills. Yes, it is a need, but whether it can be done better in the home environment itself would be a concern. The second example is recently I got a call from a lady who called up saying that my mom unfortunately had a very bad brain hemorrhage and suddenly passed away. She was in the ICU when this lady called me, and my brother, who's 22 years old, he's on the autism spectrum. How should I tell him now that mom is dying or will be no more?
Okay.
Right? Because he can't really connect with that concept of death as yet. And who is going to take care of my brother? Because I'm already married, I don't live in Surat anymore, and my dad and he are alone now. So I know who will be the legal guardian for a child whose parents pass away. The state does provide guardianship, but then they are going to get placed in an institution where are the caregivers trained to handle their challenges. So there are multiple layers that we as a society need to build up. So at Sadbhav, this was the other vertical that we are hoping to develop. We have started working towards it as far as the vocational or the pre-vocational training is concerned. But having a residential school, whether it is ideal to have a residential school or a residential facility for children, adults on the autism spectrum who cannot be taken care of at home, or they need some kind of vocational placement. So when we were in Jhagadia, they had this beautiful, campus where they interview uh, children post 12th or 10th, and they come in for vocational technical training, and they have 100% job guarantee. Now, those are typically developing children, right? What about an adult autistic? They are not all mentally impaired. They are not all physically impaired. They have sensory or behavioral challenges, but they can definitely be trained for something, but they will need a lot of support
Oh,
in
yeah.
different ways. Where they may need some medicines, they may need psychiatric care, they may need vocational training, they will need a caretaker to physically help,
Is
regulate
there
their
any place
behaviors.
which provides this? Like, are there
So
those?
in Surat, there is a school in Kamrej for girls, which is a residential facility, and they do accept children, girls who are on the autism spectrum,
The adults you're talking
the
about?
adolescent
Yeah.
girls, yes. For adult autistics, so far in Surat, there is no such facility which takes care of only autism spectrum. But like
Are there metro cities and all?
there are a few. So there is one called Anand Center or Anand Bhavan near Ahmedabad, which is a residential facility for adults who have mental health challenges. So it is not exclusively for autistic children, but yes, they are developing something like that. But that's exactly what is maybe needed, where if the child loses both parents, who's going to be the next guardian for that child? Or thinking about finances for these. So what, at a very layperson level, what we advise some of the parents who are not very affording is that the day that we diagnose the child, start putting it in some money aside for the child from now. So by the time the child grows up to be an adult, there'll be some corpus that you have. The government also does facilitate some funding for these children. So if the child gets a disability certification done from civil hospital, the child gets 1,000 rupees per month in the child's bank account, uh, which is like for a lifelong. Then there is a Niramay insurance scheme, which is again under the National Trust, Welfare Trust, where a certain amount is available as reimbursement for therapies, or they can enroll. The parents can get together, create a support group, and they will get some training and know how to create such residential facility or certain support systems like that. So there is a lot being tried by the government also. There are, inclusive schooling is still is a dream concept, I would say, which mm, is being promoted by the national education policy, but it is still going to be challenging because children with moderate to severe problems may not be able to integrate into the mainstream school straight away. They will need a lot of support there. So, schooling, vocational training, rehabilitation, as far as even their nutritional status is concerned, psychiatric care is concerned, multiple issues which I don't know where it will lead. So,
But we
from
are
our
giving
end, we
our
would try to do as much
as
as
much as we
possible.
can.
At
Yeah.
least we have started the ball rolling. And
Yeah. How did you came the path, as in I'll ask you were trained, what is neonatal?
intensive care. So I did my basic MD in pediatrics from Baroda Medical College, and Baroda Medical College Department of Pediatrics had a very strong high risk newborn follow up program even at that time. So we used to have our posting once a week in the high risk newborn clinic where we would see children coming out from the NICUs, or other referral units where children had some developmental issues, or monitoring the milestones, supporting the normal
Hmm.
newborn in our well baby clinics. And in the high risk newborn clinic, it used to be identifying their developmental issues and referring them for intervention. That was the basis, that where I was interested or curious or wanted to learn about uh, development. Then I went to Australia post MD, and that was just an additional training because I think our basic neonatal intensive training was adequate. The level 3 part where the technology came into picture, that is what was something which I loved learning in Australia. So it was a level 3 referral unit, so it was a 3 plus unit. So all the hospitals around Sydney would refer to that center. So I was very lucky to learn there as well. And during that time also, because that was the first time I saw a 500 gram baby born at 24 weeks of gestation, in the ICU for 6 months, and we discharged the baby home. And that was such a proud moment for
Hmm.
everybody that we had a party, that great, let's celebrate the
Wow.
graduation of this baby
Ah,
into the real
life.
world, kind of. So that's when we were, as a part of that training, that's how developmental assessment or developmental monitoring was always a part of our training. And also the holistic concept that the baby is not just disease. If a baby is in the hospital, it's not just disease, but it is also about the nutritional part, the family environment, the stimulation that the baby needs. What are the mandatory follow up points like the hearing or the vision that needs to be checked? And if there is any challenge, then how that needs to get addressed. So, till 2015, I would say I was doing a bit of everything. So, I was doing neonatal intensive care, I was doing general pediatric practice, doing the vaccination, growth charts, and basic treating coughs and colds as well. And then in 2015, I decided to go a step further and did a PG diploma in developmental neurology from Kerala University. So that was, I think, just to formalize the whole process. And then I took that decision that I would like to shift to developmental pediatrics altogether. So I had started establishing the CDC team in 2007, but it culminated into an exclusive developmental pediatric setup in 2015.
Okay.
So that is how it came to be. And when I was working in the neonatal intensive care, when I had to discharge babies from the NICU, I was struggling at that time. Where should I refer this child to? This child will need therapy or will need some form of intervention and monitoring. And I was not getting, adequate follow up because the parents would come back and say कि मैडम वो तो बहुत दूर पड़ता है, या एक थेरेपी के लिए इधर जाओ, दूसरे के लिए इधर जाओ, and we are not able to manage that. And they would try it for a few weeks or a few months, and then they would give up. So that's where that idea came up,
That
that
you
have
want
a
to
one
have
stop
a
solution for that.
wow.
So that's how I think
It
it
started.
came
So
up to be. And Dr. Bipin Desai sir, who's like one of the senior most pediatricians in the city, he had started something like this in the child guidance clinic at his place. And that was also one of the inspiration points for me, I would say. I was trained at Baroda, where Kashipa Children's Hospital also had a beautiful developmental unit. So I had, I think, multiple teachers and reasons or inspirations which kind of brought it all together.
Wow.
And then when I started off working in the developmental pediatrics aspect, Bhavna was actually, her daughter was born into my hands. So that is how we came together. And then
Oh.
she was learning psychology. So that's where her interest came up in developmental pediatrics. And I guess then rest was history. So we have also grown together as a team in these
Wow.
many years.
Wow.
So our team is as old as her daughter is, I would say.
18 years, I
Yes,
guess.
yes.
Wow.
So
That is
that's how it
crazy.
happened. So Urja is a name inspired by my from my daughter's name, which is Urjita, which means coming from energy, and Urja is energy. So that's where we started off with the name.
Yeah.
That everything is about balancing the energies in a child and in the family dynamics, and if that is balanced, everything will be okay.
Okay.
We
And then how
couldn't get,
Sadbhav
we
came.
yeah, so we had a lot of discussion about what should we, the name for the new venture, nahi kahungi, but the grown up version of Urja, because we couldn't get Urja as the registered name.
Why?
They have specifications. So if Urja is already registered by some other not-for-profit company, it cannot be taken up by us.
Okay.
So registering under that name was a challenge. So then we, went through the whole process of like actually naming your baby, and I would like something, the other person would not like that, and eventually we decided that Sadbhav is goodwill. And if we are creating that not for profit, that is what we want to convey, that from energy to goodwill, taking care of those kids.
Oh,
So that's how it
amazing.
came out to be.
Amazing. You started this autism, it is out of one is the Child Development Center. When Urja started, the foundation was like, helping child in the behavioral
Correct.
and all those things.
Yes.
But this was for any child, or was it since the beginning for autism?
So, like I told you earlier,
The
when I
behavioral.
was earlier, learning pediatrics, autism was not such a big problem as it is now. So earlier, when I started in 2007, probably still cerebral palsy or intellectual disability were more prominent challenges.
And for that, people had to run
Yes,
behind here
and
there.
we still would have to take them through the occupational therapy, the physical therapy, or the speech therapy part. So these therapy services are for any child with any developmental issue, whether it is remedial education or whether it's speech therapy, any child could need it. Autism spectrum now needs attention because I think 50 to 60% of our practice is for children who are on the spectrum. So the dynamics have shifted this much. So till 18 years ago, it was more of cerebral palsy or intellectual disabilities and learning disabilities.
What's the ratio of the people? Any idea approximate? And when it comes to
So
this,
if you see
disorders?
all the neurodevelopmental disorders, the percentage population is around 5 to 10%.
Okay.
So if you say the population in Surat is 85 lakhs, out of that 25% would be children less than 12 years or 18 years max, right? And 5 to 10% is the whole population. So you would have anywhere from 2.5 to 3 lakh individuals in Surat who need some form of intervention.
Wow.
And very, very basic level, if you think every classroom, there would be 5 to 10% children. So if you have 40 children in a CBSE classroom and 60 in a state board classroom, you would have anywhere from 1 to 5 children with some developmental issue,
Yeah.
whether it is intellectual disability or slow learners or have learning problems or have speech difficulties or have in like autism spectrum or have ADHD, any of these. So it is like a big number.
In Surat, has it changed the families and you, like, you would have, is there any uh, child, the changes or the improvements which, just
So
the
what
way
we,
you
what
celebrated
are
that?
traditionally called as success stories, like,
Ah.
so just recently, so Sadbhav came into existence last year. So on 1st of January, we shifted to the center, the current premises. And there was this child who is about 8 years old, who was 8 years old at that time, was coming to us for one-on-one therapy sessions. But we had thought of this concept of a preschool readiness program called the Aura Autism Learning Center, which was to focus on the pre-academic skills, the social communication, and the child's activities of daily living. And this was a pilot project that we started with 3 children, and we were seeing very good response, that children who were taught in a group of 2 or 3 children with 1 or 2 therapists supervising them were learning a little better.
Okay.
So there was this child who was 8 years old who we enrolled in the Autism Learning Center program, and he belonged to a Muslim family. Not very affording parents. Mother was very motivated to help the child learn better. When he came to us, he would not, bring his head up. He would be just so low arousal, not interested in what is happening around him. He was not verbal at all at 8 years. And gradually, over this, I would say almost 1 year now, and just yesterday, I called up a school in Nanpura, saying that this child is now ready to come into the school system, and we want him to, graduate from the Autism Learning Center. And this child, because they were not very affording, came from very far off, so somewhere beyond Parvat Patia, and would have dropped out, of all therapy. So we had given them 100% concession. So somebody was helping us sponsor his therapy, and whatever was, lagging in amount, we were, trying to patch up from our end as well. So we gave them 100% concession, and this child is now ready to enter a regular
Wow.
school program. He still will have some challenges, but he's now speaking, asking for his needs. He's able to make friends now. He smiles. He, like, he may need a prompt sometimes, but if you prompt him, he'll look at you and say bye bye. Or, like when the day we were all discussing about this, and we said that yes, now he's ready to go into a school system. And I'm sure it registered in some way in his mind, because before he left, he actually, kind of came and gave me a hug.
Oh,
And
that
I think that is our
feeling.
biggest success story, that if the child can give us that kind of a feedback of feeling loved or feeling important, that is what we would want to give to each and every child and the families also. So
Love
yes,
it.
that is, I
That is
would
the
say, one of
feeling.
the way. And I guess we wouldn't call it a success story, but we do take pride that we would ensure evidence based practices. We would not, randomly suggest a therapy service just to increase business, because it is a not for profit. So if we add on services without,
Then
paying the therapist, then it will never work out. So yes, we are very proud that we are getting in children coming in from US, UK, Canada, uh, just for getting services. So they come here for 3 to 6 months, and we work on their basic skills. Again, like I said, we cannot guarantee 100% recovery, but we
you
can
can give
definitely improve
100% right.
improve the
Yeah.
outcomes.
Yeah.
And they are coming by word of mouth.
Hmm.
So some child who has gotten a little better, is doing better, is back into school system there, the parent would have shared that with somebody else, and now they have come in. So that is the way I would count our success to
True,
be.
true, 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 true. This is like doing something, as in one is earning factor is always there. You should earn, but um, the purpose of helping the society in the best
Absolutely
way and earning via that is a
true.
feeling which is
So this is what we all, developmental pediatricians, when we get together, we joke that pediatrics, as general pediatricians, we would probably earn well, but as developmental pediatricians, because we know that goals are so different for each and every child, and it's such a long term process, that we cannot think of profits and margins, or growing in terms of earning or building our bank balances. That is never going to happen. So if a pediatrician who is graduating and is asking me whether I should become a developmental pediatrician or not, I would put this point across to them that you should get into it if you really focus on the outcomes, not on your bank balance. If you're looking for glamour, if you're looking for magic, it is a long term thing. It's not going to happen in developmental pediatrics. A lot of patients, I and Bhavna, I think, are blessed in that way that both of our mindsets are very similar. And we have a very strong support system back home, where our families have actually told us that, this is how you continue to work and give back to society. So it is not just an idealistic philosophy that we would say, okay, yeah, we are giving back to society. I think I have learned or gained a lot more than what I have given back so far. Every child has taught me something more, and I hope to keep getting to be a better person because of that reason. So yes, if you are a pediatrician wanting to set up a private practice as a developmental pediatrician, that is not going to be your bread and butter also. Because whatever you get, you will have to put it back in. Not to, again, grow in terms of wealth, but yes, in terms of outcomes, for
wow.
sure.
Okay, wow.
And a lot of people in Surat are wanting to do something, that they just need a trusted person to do it with. So
Hmm.
yeah, we hope to be that kind of institution.
Hmm. Yeah, and it is going
Thank you.
to
That is
work.
something I will
No, no, no.
always
It
pray to
is like
God for.
I am so blessed to get in touch with you, and I didn't know that about the history about you, Bhavna Raja. And when I needed psychologists, like
Mm,
even though I was consulting psychiatrist, and
mm.
I needed a psychologist. So Kanta Bhutra, I'm not sure, Dr. Kanta
Yes,
Bhutra. I went to two, three,
yes.
three different psychologist or counselor, whatever you say,
Mm.
vomit out my story, whatever is happening, and used to get
Venting.
nothing, like, kind of that vibe or the kind
Yeah.
of questions they
Feeling
should ask
judged.
or anything, as if, like, there should be. And then I lost hopes. That's
True.
when Dr. Kanta Bhutra told, Havna Raja, you go, you
Yes.
will. And she was the one, she didn't let me talk the entire story. She asked in between specific questions, specific. And I was like, oh my God, I needed this.
Right.
And then suddenly she approached me for, like, there's Sadbhav, and then I met you, and now
Yes.
I'm having this podcast with you. It's
Yes.
I believe there are some dots which are connected
I
for
know.
us to
Yes.
maybe work together for the betterment of
Absolutely.
the society.
The
That's what,
goodwill dots, we call
yeah, the
them now.
goodwill dots. I believe that's all. I mean, I have so many more questions in terms of maybe the one-liners. As in, right now, the screen time is increasing, and people, the kind of disorders which, be it like, speech and all those things, I believe the ratio is keep, because
Will
of which
keep
it is,
increasing.
isn't it a thing to worry, because
It is a very big concern, because that's what we have now started telling moms, that the
Yeah.
baby doesn't need a smartphone, the baby needs a smart mom
Yeah.
without a smartphone. So
Yeah.
it is
Yeah, because
challenging.
before I used to see kids and meet kids, like, I'm not talking about very young age. They smile and they have a
Yeah.
lot of magical energy in
Yes.
them. They radiate, but the kids who are in the teenage, I won't say 18, but 10, even 5 to 10
Yes.
years old.
Yes.
No, like there are so many relatives who
All
are
the
there and they are
energy.
just
Yes.
in the corner in their cell
Absolutely.
phone. They don't even care to say
And
hi.
major
And they
behavioral
have,
issues because of that. Like you
yeah,
take it away for a moment and they would throw a
yeah. As
massive
in, I go
tantrum.
with my friends also.
Yeah.
There's this, we go for dinner and all, and there's a
Yeah.
kid. The kid is enjoying the
Absolutely.
iPad, and doesn't matter for 2 hours
So
sitting.
that's the saddest part, the joy of exploring, the innocence of, seeking new experiences, or the curiosity that should be in a child has completely been lost. And
And
that
this is also causing a lot of mental health issues, which is
absolutely, yes.
going to come, maybe not now, but after years.
So, recently I was in a musical show. I was listening to a bhajan sandhya actually, and there was this small girl, just 4 or 5 years old, in the row ahead of me. Throughout that 2.5 hours event, she was using her mom's phone, taking selfies of herself, pouting
Oh,
at the phone.
oh, oh, yes,
You
I
know,
have seen that.
being the person that I am, like
You
I
can't
I
take
couldn't
it.
stop myself, and I had to actually talk to mom at the end of the program. I said, I totally appreciate that your daughter loves to take a selfie of herself, but I would be happier if she at least listens to some part of the music, enjoys it, appreciates it, and helps her mind develop more. Because the moment the mom took the phone away, and she was like, like the behavior started to
But
come up.
it comes from the parents also, right?
Yes.
Completely,
So
because that's the
nowadays,
learning.
whenever I ask the child screen time history, I also ask the parent screen time history. And the parent then sheepishly says, "Ah, madam, thoda to zyada hi hai." But that's the sad part of it. Stop treating, the laptop was for work. More than this gadget on your lap, the baby needs to be in your
Oh,
lap.
so true. Oh my
So,
God. But then comes the career problem also. Within 6 months to 9 months, they have to go back to work when it
and
is
they
comes to
should,
come.
but why not depend on your support systems, your family members? If you don't have family members, create a group of friends. If I'm a working person, which I am, like even when my daughter was younger, I was lucky, I would say, that I had a family backup, that they could, take care of my child when I was away at work for some time. But having said that, I also made it a priority that whenever I was at home, then I was with my daughter. It was not on the screen, or it was not working, or not cribbing, that she keeps clinging to me at that time. That was a given, right? At the same time, if I needed to put her in a daycare, create a good daycare system where, a few friends can get together, take turns taking care of each other's children, right? That's easier to do than worrying about whether this daycare is good or not. So, for play dates, taking the child for activities, or just getting together for a story session, it doesn't have to be, something very fancy. You don't have to go to a play zone. Just
Hmm.
go to the playground every day evening for an hour
Yeah,
with your child. So, yes, work from home should not become a challenge.
true, true, true. Which is there. But this is very courageous what you are doing. And when it comes to bank account versus when it comes to being a
Yeah,
development,
absolutely.
was there a moment where you felt like I need to also think about the finances or anything, this is very big problem, how much ever I'm doing, it is always going to feel like not enough.
So,
Because right now
that
when I,
was the case, especially every time that we had to shift out of. the existing setup, because real estate in Surat is not something we can easily afford to
Yeah.
buy. So we've always been in rental properties after my first clinic. So whenever we needed to shift into another space, getting the space ready, we had to keep chipping in. It was never going to be enough just on the basis of our business. So that is something we have been doing. And like I said, because we have a family backup where we don't have to worry about, aaj raat ka khana kahan se aayega, that also makes me think all the families there who have to struggle with making ends meet, also have to pay for therapy, also have to travel at least twice or thrice a week for therapies, how much more is their struggle? So, if we can provide some solace in that, or some way of relieving them of that challenge or stress,
Yeah.
we can give it a try.
Hmm.
Finances will always be a challenge. So, yes, if I get a donor who says that I am going to give you, an X amount, and don't worry about any child dropping out because of the finances, that would make me the happiest person even before the parents. Right. So,
Yeah.
yes, we do need help, and do need like-minded people to support every child, not just financially. Yes, finance is a big aspect of maintaining long-term therapy, but also socially. Just accept the child for whatever the child is,
And yeah.
and the family, support the family in the best possible way they can. I would want the schools to support the children by, at least getting their teachers trained to manage a child with special needs in the classrooms itself. So at least in the primary sections, they don't need to be going into special school systems at all. And whatever therapy services are helping the child learn, that can be generalized better in the classrooms or in the families, or in the outside world. So there is a lot to be done.
It's a journey.
Every
It's
small
a
step
journey.
is a journey, taken further from there.
Yeah.
So,
Now we'll have a very short rapid fire. Okay.
sure,
And like, just answer in few words or one word or
sure,
something of
sure.
that sort. Okay. For adolescents today, what are the most underrated challenges they face?
Most underrated challenges would be peer pressure. Wouldn't say underrated, but yes, that is the biggest challenge.
Oh,
And
yes.
social, acceptance.
Yeah. So much they are lying, yeah. On face. We don't even understand. That's what parent thought I am a psychologist and came with a problem that whatever my child says, he's lying. I don't know how to make things better. I'm like, I'm not a psychologist, but still, you just 1 hour you sit with my child, and then, okay, I was like, do some gratitude, let's do this or talk.
Yeah.
He's like, he told me certain stories. He's like, everything is a lie. And she's scared what to do. I
True.
mean, how all these things are even coming.
See, it must have probably started also at some point when the child, received a phone call on behalf of the parent, and the parent told the child to lie.
You
बोल दो
never
कि
know.
पापा घर पे नहीं है या
Oh
मम्मा
my
घर पे
God,
नहीं है.
even this.
It can start from there.
True, true,
It
true.
it
Brain, I
The
don't know what
first lie. See, developmentally, children will lie at around 5 to 7 years of age. They will inherently lie to get out of a scolding, or not get
escape
caught.
from,
That is
yeah.
very normal. How many of our parents guide the teenager to wear a helmet to keep themselves safe, instead of telling them कि पुलिस पकड़ लेगी इसलिए helmet पहन ले? They are teaching them to lie.
True, true. This is a little long form question. How should parents talk about body image, puberty, or mental health without being awkward or intrusive? Majorly, what I see right now is um, people are also having live-in and all those things,
True.
and very early age having relationships and all,
Yes.
and for the parents they want to be the companion and friends, and how it is going to affect the mental health, how the parent should be open upfront about it, like about the things.
So I think the parents need a bit of preparation, because your parenting skills are as old as your child, and every child born is a new set of parenting skills. When they become teenagers, the inherent set of problems, especially talking about puberty or sexual relationships or intimacy or staying safe, cyber security, all those things should start as early as 1.5 to 3 years of age, when you are teaching the child the right vocabulary for body parts. Just as you would teach the child, show me your eyes and ears, also teach the child that chest is chest, it's not, or your penis or your vagina is the name of a body part, not a susu or a pee pee or a boo boo. Right? So starting with the right vocabulary, it's very important. Also, we do a lot of awareness sessions in a lot of schools across Surat, especially in the adolescent age group, right? So if you don't know how to approach your child, reach out to your pediatrician. The pediatrician will guide you. And it always doesn't have to be like sitting down with your child, let's talk about, how to establish relationship, nothing like that. Netflix is a good starting point. Why should Netflix have ratings when it is not applied at home? Right. So talk to your child about the ratings first. What does the rating mean? What does a 13 plus or an adult category mean? What does a sanitary pad mean? And not just for girls, for a boy also, right? Start from those simple conversations. Teach them about your own experiences as a teenager, or what a crush meant to you at that age, and whether it should be taken seriously. What are the challenges of a crush or just a casual fling, or what are the challenges of a live-in relationship for that matter if it is not well thought out? What can be the challenges of sexually transmitted diseases, or lack of vaccination at that age? And then get on to the more serious matters, because preventing sexual abuse is as important as keeping them sexually safe.
Yeah.
Right? So it needs to be addressed without any awkwardness. So
True.
today, if my daughter needs any advice, it is not necessary that she should come to me as the mother. Even dad knows how to talk to her about it.
Yeah.
And
They should
that's
be.
that's how easy it should be.
Okay.
It is always all perceived awkwardness. The parent has already thought about कि ये पूछेगा तो मैं क्या जवाब दूंगा, ये तो मुझे नहीं समझ में आएगा, ये
All the
तो
justifications
हाँ.
and all logics from mind.
Exactly. Take it from what the child asks you.
Yeah.
So there is this very famous joke that whenever we are doing a puberty session with parents, and there is this cartoon where the dad is telling the son, come son, let's talk about sex. And this teenage son answers back, okay dad, what do you want to know? Right. So take it how the child wants it, and there still may be some questions you can't answer straight away. Take that also as a starting point. Tell your son or daughter that this is a good question, I don't know the answer to this, let's find about it together.
Got it.
So that way you can keep your child safe from pornography, safe from cyberbullying or cyber stalking, physical bullying, sexual abuse, a lot of stuff.
When it comes to intercourse, having sex, one is the sexual transmission disease also.
Yes.
But the other is also the energy exchange.
So
In the spirituality world, if you don't, I don't know, you believe in that or not?
I do believe, but I would not use that as the scientific background of it only.
Yeah.
Right. The point is that whenever you indulge in a sexual relationship, there is some emotion connected to that. Even if it is just exclusively sexual pleasure, that is still, there are some chemical changes happening in your brain. And if you go into the premise of it with the thought that, okay, this is not something I'm going to tell everybody, or this is something to hide, because inherently I know it is wrong, then it is still going to have a negative effect on you. So committing to a sexual relationship should never be a casual thing. And the reason why the licensing age for marriage or drinking or driving has been set is because all these decisions, these life decisions, are made by the prefrontal cortex in our brain, the critical thinking cortex in our brain, and that matures between 18 to 24 years of age. So if you take decisions based on your crush or your impulses earlier than that, you're more likely going to be wrong. Not all childhood
True.
sweethearts are lifetime
True.
partners. Breakups are common in that
Yeah.
group also.
Yeah.
At the same time, not all arranged marriages have broken up,
True.
right? So
True.
the whole process of marriage or living in together or sexual intercourse or having a family or having a child, all that has to be in the natural process, and the rules have not been set just to impose on somebody's freedom. It has some scientific basis
Yeah.
to it,
Yeah.
right? So that is, I guess, how the parent should also approach it for that matter.
True. 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 This, in spiritual journey, like I don't know whether you believe in.
I do believe.
You do
So
believe.
I do pray every day, and
No, not about praying. What I've seen is there's a scientific reason behind meditation,
yes,
behind breathing, and
yes,
it has cured in certain ways when it comes to um, some physical pain or
yes,
going through
yes,
diseases or
yes.
going through mental pain also. So, isn't it something which should be a part of education system, not the spirituality or any religion specific, but
So
the kind of why uh, there's a need for gratitude or why there is a need for um, breathing and to
so
reduce the
so
cases
that's
of
why I said, like, we need to go back to the basics. So
oh, the ancient time it used to be
if you
like this.
see in the ancient way of teaching, the child would be in the Gurukul
Yeah.
after 7 years of age. Okay, when the Upnayan Sanskar or the Janoi would be given to the child. 7 years is the time when the maximum development has been
Happens.
achieved.
Huh.
Then the child goes into the Gurukul and stays. It's like a hostel situation,
18
right?
years,
With
yeah,
the
21 years
Guru
old,
and
yeah.
the Guru Mata. And then they are not just taught the scriptures or the formal learning of reading, writing, and math, but also life skills, household chores, exercise, breathing. That needs to happen on a daily basis. Now, our learning system has become so academic heavy
So.
that the sports always takes a back seat. If the child is slightly underperforming, the first thing that goes is the sports class or the extracurricular music class. But all those skills are so important for the holistic development of the child. So it is funny, but it's a part of my prescription whenever I see a child with ADHD or learning disability, that sports activity must be initiated to
Wow.
help the child pay attention better.
This was such a beautiful, perception which I got, like ancient learnings.
Yes.
Right today in the modern world, we call it spirituality,
Yes.
but there's the scientific reasons behind it, and in the
Absolutely.
modern education, and everything is gone. That's why I see these are the cases which are coming up, and it is just increasing.
Absolutely.